Sacrocolpopexy, not a top 10 dinner conversation. In fact, you're probably here because your doctor brought it up and you have questions. Stay tuned and we'll review everything you need to know about sacrocolpopexy. Hi, I'm Dr. Rich, and my passion is to provide every woman with practical knowledge about the world of women's health. Sacrocolpopexy, chances are you don't know what that is unless your doctor said you need one, or you're just into weird medical terms. Either way, come join us and check it out. Welcome back. I want to thank everybody for tuning in today. We have our esteemed colleague, Dr. Erinn Myers, joining us via Zoom from Charlotte, North Carolina. Erinn is a urogynecologist, and we're very delighted for you to be here today. Thanks for joining us.
Thank you for having me. I'm very excited to be here.
So today we're going to talk about a procedure, a surgical procedure. The term is sacrocolpopexy. Now, it's a mouthful, and most patients probably haven't heard of that, but there are definitely a number of patients that have, and they want more information. So in terms of sacrocolpopexy, or we could call it sacro, what is that? What is it for? And how does that relate to prolapse?
I love this question. I talk about this every day with my patients. So sacrocolpopexy is a mouthful, and it's really made of three smaller words. So sacro stands for sacrum. So that's the lower back area. Colpo stands for vagina. And I think we all know that area. And then pexy means, kind of putting them together. So sacrocolpopexy means sacrum, vagina, putting together. So essentially we're using some support of the lower back to help when the vagina falls down, we can support that vaginal prolapse with the lower back.
How might a patient present to your office if they have prolapse? What symptoms would they have?
A lot of times patients will present with just feeling of heaviness or pressure, maybe feeling a bulge, or sometimes they'll say they're sitting on an egg or feeling uncomfortable. Usually it's not pain, interestingly. So women who present with pain as a primary symptom, that tends to not be prolapse, but mostly just heaviness, pressure, a bulge. And when it's really advanced, some ladies will complain of prolapse coming all the way outside the vaginal opening, and they can see or feel that.
Okay. And patients will often ask, what is prolapsing? So what organs, or what is it actually? What is the egg that they're sitting on?
That's a great question. They're always so nervous about what is prolapsing. Everyone wants to know, what is this? And what I always tell them is, don't worry, it's just vagina skin. The vagina is kind of coming inside out on itself. What's behind the vaginal wall is really what kind of tells us about the symptoms of what's going on. So sometimes it can be the bladder. And if the bladder's behind the vaginal wall, then we have problems with emptying our bladder, urination, things like that. Sometimes it can be the rectum. And if the rectum is behind the vaginal wall prolapsing, it can be more difficult to have a bowel movement. And sometimes it's just the uterus. And so in those cases, it's more just heaviness or pressure as the main symptom. Sometimes it's all three. And so really an exam helps to understand, for the physician and patient both, to understand what's going on. But in no way, shape, or form is it really going to be dangerous to touch or anything like that. It's not, oh my goodness, don't touch my bladder. No, it's just vagina skin prolapsing.
I see. And a lot of patients will come in, particularly elderly patients who have many urinary tract infections. And sometimes they're not suspected to have prolapse by their care providers. And yet after years of infections and even hospital admissions, we find out that that's the actual cause, is prolapse behind these infections.
That's absolutely right. When the prolapse is predominantly related to the bladder, it can be very difficult for ladies to empty their bladder. And when urine stays inside over time, as you mentioned, it can get infected.
And I have a number of patients ask, is this just a normal part of aging because, you know, my mom or my grandma had a similar thing and they were uncomfortable, but they never did anything about it.
Well, I would say to that, well, yes, it's more common in women who are in the menopausal years or postmenopausal years, but that doesn't mean it has to be normal. And so we can address that and help them achieve a better quality of life by eliminating some of those discomforts.
And for the surgery itself, and you know, I'm going to go ahead and offer that you and I both like to use the robot for this surgery, although it can also be done through an open type of an incision. How is it actually done? So you'd mentioned that there's the colpus, which is you know, the vagina, and then the sacro, which truly is a ligament on the sacrum. Mm-hmm. So how does that actually work? How do we attach those two, and how does that provide support?
Well, actually, we used a mesh graft. So part of the mesh is attached to the vagina, and the other part of the mesh is attached to the sacrum because, as you might imagine, there's no way the vagina can reach the sacrum. So we need a little graft to attach the two together. And so that helps provide the support.
So in wake of some of the vaginal mesh issues that came to light through the FDA and then became kind of publicized on television and radio, and patients have this awareness of what they typically refer to, at least in my office, as a bad mesh. So is this different, and how is it different?
I think that's a great question and something I talk about all day long, every day. So I'll try to explain that not all mesh is bad, and some mesh is very, very good and can help women with both incontinence and prolapse. So for prolapse, I try to explain the colpopexy procedure or sacrocolpopexy procedure has been around since about the 1960s. So this is not something new that we're doing. We're not experimenting. We're not trying a new product out. We're not, figuring things out as we go. This is a tried and true gold standard treatment option that is really good for women. Some of the other options that have come and gone along this time may not have been as good. And so there are different vaginal mesh products, and those products came on the market in the early 2000s. And, based on the route of entry is what I try to explain. So vaginal mesh is placed vaginally. So if you place a sterile graft through maybe a non-sterile area, it might get infected or you might have pain. And so vaginal mesh products came on the market, like I said, in early 2000s, and they're now off the market. But a colpopexy mesh is completely different because it goes through a sterile area, meaning the abdomen. So we take the mesh through the abdomen through little tiny holes that we place for our ports, for our robotic ports. And that mesh goes right through those tiny holes, about the size of a pencil. And then that mesh stays sterile the whole time. So much less risk of infection, much less risk of pain, and really just completely different procedures.
I think that's going to be great news for people to hear, and probably some peace of mind knowing that the thing they're worried about, the vaginal mesh product, nobody could use it if they wanted to. It's not currently on the market, and this sacrocolpopexy procedure has a 6-decade, track record of good outcomes.
Absolutely. And it's, stood the test of time. It's not been pulled for the market. So I think that should help them feel safe. And I think that it does. When I talk to patients about the differences in colpopexy mesh and vaginal mesh, once they understand the differences, they feel very safe going forward.
Sometimes I find it helpful as well to kind of explain at its basic level. Mm-hmm. Mesh is really just a series of interwoven permanent suture. So somebody might fix a hernia, for example, with a permanent suture. So this is just kind of an interwoven matrix. It's the same thing that, we would use. It's just a, piece of suture material by itself is actually very inert. Complications can happen, but they're nowhere near the risk that happened with vaginal mesh, which is why this is safe and that's off the market.
Yes, absolutely, I agree.
If you found this information helpful, please subscribe and follow up for our next Sacrocolpopexy video. And if you have specific comments and questions, please drop them in the section below and like and share.